It's 96.3 WHUR, old school 90s and now, and something that everyone should be talking about, COVID-19 vaccines. We have a very special interview today. We have Dr. Immergluck. She is a professor and physician scientist and currently serves as the site's principal investigator for participation in the U.S. COVID-19 Prevention Network, which includes the COVID-19 vaccine clinical trials. She is a practicing general pediatrician, a pediatric infectious diseases specialist, population health service researcher, and serves on the executive board section on infectious diseases for the American Academy of Pediatrics. Currently, she is a professor in the Department of Microbiology, Biochemistry, Immunology, and the director of the Pediatric Clinical and Transitional Research Unit. Dr. Immergluck, thank you so much for joining us on 96.3 WHUR.
Well, thank you for having me.
I have a bunch of questions. One of the things that we had a big conversation on our show, and we find that so many of our listeners are really hesitant for taking this COVID-19 vaccine, and there's some people that still believe that it is not real.
You know, as a practicing physician and also a researcher on the clinical trials, you know, I do see the impact of COVID in the clinical setting. We've been hit hard, terribly in this last surge. And so I know it's real in the sense of the hospitalizations that I see, the deaths. As a pediatrician, I'm still, you know, sadly astounded by how many children are impacted, even though they don't make the news headlines.
Let me ask you this. I got my first shot, my first Pfizer shot. And thank you. And I know that some people have, like, reactions to it. My wife and other friends, when they got the second shot, they didn't feel too well that first day, and then it kind of went away, and then they're perfect. What is it that causes people not to feel good with the shot?
So as a pediatrician, we give out a lot of vaccines, and as a consequence, we prevented a lot of diseases that we don't see in our childhood anymore. The idea behind the vaccine is that we try to prime your immune system. So we let your immune system get a sense of what we want them to be on the lookout for. In the case of the COVID vaccines, we take a piece of the virus, so there's no live virus getting injected into anyone, and it's called a spike protein. It's on the surface of the virus. We introduce it to our immune system and say, take a look, and we just want you to have this image of it. Now, some people's immune system, because we're not all the same, really, we're very tight and trying to keep out things that we don't like. And so you might mount a response that says, hey, I'm going to try to get rid of this thing that's not usually part of who I am. And you might have a fever. You might have some, just get tired out because your immune system's already priming up. Then we allow our immune system to really register that, process that, develop the defense mechanisms that are complex in our human body so that when we reintroduce the exact same spike protein 3 weeks or 4 weeks later, we get what we call a boost phenomena. With the boost phenomena, it's really saying, hey, you saw me before, see what you can do. Okay. And so oftentimes when I tell people when I give vaccination, the theory behind all vaccinations has an idea, priming and boosting, is that you'll likely feel more symptomatic with that second dose. I myself, for example, had no reaction whatsoever with the first one. But with the second one, it just did knock me off. I was really tired. I felt like I had pulled an all-nighter the next day. And that is a typical reaction, whether it's COVID vaccine or it's pneumococcal vaccine or tetanus vaccine. A lot of times people have a reaction on that boosting dose.
We have to ask you, Dr. Immergluck, about our college-age children. I understand that there is a trial coming up for college-age kids and the effect of COVID-19 on them.
Frank and I have 4 college kids between the two of us, from Atlanta to Athens to Baton Rouge, Louisiana, and I've heard that there is an upcoming college student age vaccine trial. Can you tell us about that?
Yes, we're really super excited to be a part of this. It's a study that's coming out of the U.S. COVID Prevention Network, and there are 22 sites across the country that are participating in this trial where we're looking at 18 to 26-year-olds and giving vaccination to them at 2 different time points. So the kids that are enrolled in this trial, and we're going to try to get at least 500 kids, will be randomized to either get the vaccine at the beginning of the trial or like 4 months later. And the reason that I'm super excited about it is because, number one, every one of these kids are going to get a vaccine. And I think if you look at the issues that we're having with distribution across our country and the priority groups, these young adults are kind of at the latter half of the people that are going to likely get a FDA-approved EUA vaccine. What I think this study does is going to allow us an opportunity to really understand the transmission, viral shedding that's happening, because maybe many of these young adults are asymptomatic or mildly symptomatic and would have been missed otherwise. As far as having COVID and being able to transmit it unknowingly. And so there's this kind of like security in this population, I think, that might be false, but we need to understand that better in the terms of that in the context of vaccination. And that's what this study does.
There's this big thing, we jokingly say, oh, I had COVID last year. And then we hear about people who had COVID and they're like, well, I'm immune. And we know that you can get COVID twice. But can you explain to us how the antibodies work and your immunity after you get COVID, if there's a certain time frame that lasts?
Before I dive into COVID antibodies, let me bring up flu antibodies. Flu is a virus that circulates in our midst every year, and we have some bad years and we have some better years in terms of number of cases, number of hospitalizations, number of deaths. We have a flu vaccine every year, and we try to predict what strain might be circulating in our community, that we would formulate the vaccine so that we would try to increase the effectiveness of that vaccine in our population. We, as humans, we have antibodies that we develop to all sorts of germs, but there are strain differences. And if somebody's been vaccinated a number of times, then their chances when they encounter another strain of the, let's say, flu, they may not get quite as sick as somebody who doesn't have a whole lot of different types of antibodies based on the exposures in the past. That immunologic memory is very important. Pivot now to COVID. SARS-CoV-2, the virus that causes COVID infections, is a coronavirus. We know that. We have examples of human coronaviruses and the behavior of how people get infected in that context. So we take that information and we take the information that we understand also from the novel coronaviruses that have happened historically, the SARS and the MERS, and we put that all together to help us understand a little bit more about SARS-CoV-2. We have people who got infected. We now know a year into this pandemic that there is the possibility of reinfection. How badly do people get when they get reinfected in terms of illness-free? That's not clear, but it definitely happens. So when we measure antibodies, and really if we look at the antibodies that are being measured in the way that are out there and available to the general public, it's the neutralizing antibodies. But that's not all what our immune system does. We have lots of parts of the immune system that we're not measuring, but it definitely assists us in fighting an infection. Yes, we may be infected with another strain. How severe that infection will be, it depends a little bit about that person. And time will tell. One
of the things I've been watching and been afraid of is they're saying the unknown long-term effects that COVID is having on people.
Especially Black women.
There are clear indications that there are people who have some of these consequences of COVID infection. But how much of that is multifactorial, i.e. it's due directly to the virus and the response of our immune system to fighting that virus off. So it's an inflammatory-related response versus some of the things that are tied to just us living in a pandemic, fighting off the virus, and then having to deal with all these other stressors on our system. What are the consequences of that? I think we're going to find out more and more that there are these factors that are not necessarily tied just to the virus infecting our cells and the consequences of that impact who gets some of these long hauler symptoms.
We've been speaking with Dr. Immergluck, a professor and physician scientist for the participation in the U.S. COVID-19 Prevention Network, which includes the COVID-19 vaccine clinical trials.
Let's talk about our elderly folks, the 65 and up, our matriarchs and patriarchs of our family. If our grandmas and grandpas have gotten vaccinated and we've gotten vaccinated, is that a green light that we can now hug on them, spend time with them? Like, what precautions, if any, should we be taking at this point?
That's a really good question. And I think if you look at the vaccine that have gotten the EUA approval, and the reason they were given the EUA does not mean that they they've passed all of the steps needed for kind of what we call post-licensure vaccine, use for the general population. It just means that while we're in a pandemic and we're in this kind of public health emergency, they demonstrated the safety profile. They met their endpoints to protect the general population in a way that we think is important for us to go ahead and get these vaccines out. Moderna, Pfizer, the Johnson & Johnson product, they were looking at their endpoints with moderate to severe disease. They did not look at the durability of the antibody response that people had once they're vaccinated. They did not look at the transmissibility, okay? Now, in general, because the longer that we are in this pandemic, the more we're understanding, we think that people who are vaccinated, if they were to encounter SARS-CoV-2, that their likelihood to shed viral particles to the point of transmitting to others may be reduced.
Dr. Immergluck, we have a question from Casey. Casey, go ahead and ask your question.
My question is, if a person have never took the vaccine, and then all of a sudden you all saying that it's safe for us to not to wear a mask, how we know if that person did or did not, and then we come down with the virus?
Dr. Immergluck, how do we know it's safe to stop wearing our mask?
Is it 100% safe to shed your mask as a consequence if everybody's vaccinated in less than 6 feet? I don't think we're at that point. The issue is taking it in context of individual, what's your risk of picking up something?
Thank you so much for that information, Dr. Immergluck.
Do you have any contact information?
Sure. We actually have an 800 number.
Okay.
We really want to be a trusted source to our community. So that number is 1-888-788-0644. We try to be as timely as possible with getting back to people.
888-788-0644.
Dr. Immergluck, thank you so much for joining us here on The Frank Ski Show with Nina Brown, 96.3 WHUR, 49 years of sounding like Washington.